In a televised interview Sunday, Dr. Scott Gottlieb, a former commissioner of the Food and Drug Administration, warned COVID-19's resurgence in the United States is likely more pervasive than reported data suggests due to undocumented cases, but said that may actually mean the nation is close to turning the corner on the new Delta variant outbreak in the coming weeks, at least based on its trajectory in the United Kingdom. If you look at the UK in the last 7 days, they do appear to be turning the corner, Gottlieb said Sunday, pointing out the downward trajectory on new cases in the nation. It's unclear whether that's going to be sustained, since they just lifted a lot of the mitigation they had in place, but if the UK is any guide, we are perhaps further into this epidemic and hopefully going to turn a corner in the next 2 or maybe 3 weeks. The highly contagious Delta variant, first identified in India, sparked a third wave of the pandemic in the United Kingdom this summer despite it being one of the most vaccinated countries in the world. New daily cases in the country fell to a months-long trough earlier this year until the Delta variant became its dominant strain, pushing weekly cases up from less than 25,000 in early June to nearly 350,000 in mid-July and forcing the country to delay its reopening for about a month. Daily infections peaked on July 17 and have since fallen about 45%, 350,000. That's about how many new COVID-19 cases have been reported in the US over the past week, up 172% from just 2 weeks ago and the highest levels since late April. About 49% of all Americans are fully vaccinated. Another factor likely contributing to underreported COVID-19 cases, Gottlieb said, is the lack of research on breakthrough infections, which the CDC is currently only tracking when people get hospitalized. We need to understand whether or not vaccinated people are developing some non-clinical or mild infections and whether or not they can spread the virus, because that's important, Gottlieb said. Thus far, he says the US has had to depend on data from nations like Israel, where researchers last week suggested the Pfizer vaccine is only 39% effective against the Delta variant. However, those findings conflict with other studies indicating only slightly diminished degrees of protection against mild illness. Last week, for example, peer-reviewed research out of the UK concluded the vaccine was 88% effective after 2 doses. Gottlieb, who sits on the board of vaccine maker Pfizer, said it's not likely the US will authorize the company's COVID-19 vaccine for children under the age of 12 before winter. The clinical data for its ongoing trial, he says, should be available in September, but the FDA is likely to then require up to 6 months of follow-up testing before moving on authorization.